one of those syndromes that are now recalled mainly by medical historians. Medicine grows and evolves, which implies an increase in various research methods that facilitate the diagnostic search for doctors. In this context, some syndromes, the combination of which ultimately led to the diagnosis of the disease affecting the patient, lose their relevance, and may even disappear from medical references and the Internet altogether. An example of this is Orner's syndrome. Identifying this syndrome, I will not list all its manifestations in my post, so that people who are not familiar with medicine do not engage in self-treatment, mistakenly attributing it to situations where the actual causes may be more serious. Allowed experienced doctors, without ultrasound data or blood tests, to rule out acute abdomen, which I discussed in my earlier publications. I repeat, the information provided below is for familiarization only, as the onset of abdominal pain of any kind requires seeking medical attention to establish a correct diagnosis and appropriate treatment. Sir Orner's syndrome, also known as intermittent ischemia of the abdominal organs in patients with obliterative atherosclerosis of the mesenteric vessels, occurs in patients who have obliteration, blockage, of the arteries supplying the intestines and other organs of the abdominal cavity. In older references, it may also be referred to as abdominal angina. This syndrome may be caused by atherosclerosis, thrombosis, or embolism of the mesenteric arteries and occurs in elderly and geriatric age. Symptoms of Orner's syndrome may include chronic abdominal pain, weight loss, nausea, vomiting, changes in bowel transit, bloody vomit or stools, as well as signs of systemic disease such as fever, loss of appetite, and general weakness. However, it is crucial to distinguish Orner's syndrome from the symptoms of acute abdomen, as the latter is a medical term describing an acute state of abdominal pain that requires immediate medical attention. Acute abdomen can be caused by various reasons, such as appendicitis, gastric ulcer, bowel perforation, and other acute conditions requiring urgent surgical intervention. Therefore, if you suspect Orner's syndrome or experience chronic abdominal pain, consult a doctor for a more accurate diagnosis and appropriate treatment.